You ever think about how the exact same medical problem can lead two people down completely different roads? I mean, for one person, it might mean losing their job, but for another, they just go home from the clinic, no big deal. Well, today, we're going to unpack that puzzle. We'll look at a really interesting medical scenario that pulls back the curtain on the hidden rules that govern our health and safety.
So, let's just jump right in with a question. I want you to imagine for a second that your body has this, built-in alarm system for when things are about to go wrong. Maybe your heart starts racing, you get a little shaky, a cold sweat. Now, what if that system just went silent? Poof, no warning at all before a crisis hit.
Well, that silent alarm actually has a name. It's called hypoglycemia unawareness. Basically, it's a condition where someone with diabetes just can't feel those classic warning signs of low blood sugar. And without those signs, they can go from feeling totally fine 1 minute to being dangerously confused or even passing out the next. This condition, this is what's at the very heart of our story today.
Okay, so let's meet our two people. Over here on the left, we've got Alex. Alex is a professional commercial truck driver. And on the right, we have Sam, just a regular patient who gets brought into an urgent care clinic. Now here's the thing. Both Alex and Sam have just had an episode because of this hypoglycemia unawareness. But as you're about to see, the worlds they're about to step into couldn't be more different.
So first up is Alex. For him, this isn't just a personal health thing. Not at all. Because he drives a huge truck for a living, his medical status is immediately looked at through one very specific lens: public safety. And that lens is controlled by the super strict rules of the Department of Transportation. The DOT.
And in the world of the DOT, let me be clear, hypoglycemia unawareness isn't just a little worry. No way. It is a major safety red flag. There is zero gray area here. The entire system is built to react and react fast because the risk to the public is just so high.
So why are the alarm bells ringing so loud? Well, think about it. A driver who can't tell their blood sugar is about to crash is at risk of suddenly getting confused, losing consciousness, or even having a seizure. Any one of those things means they are completely unable to safely control a massive vehicle barreling down the highway. It's a worst-case scenario.
This quote right here really just gets to the heart of it all. The DOT medical examiner has one job, and one job only: to protect the public. Their role isn't to help Alex manage his diabetes over the next 10 years, it's to decide if he's a risk to other people on the road right now. It's an incredibly sharp, incredibly narrow focus. So for Alex, the outcome is usually pretty straightforward. You have a system of rigid rules designed to completely eliminate risk, and that means a driver with this condition is typically considered not medically qualified to drive, at least not until everything is evaluated and stable. It's a clean, simple decision based on a clean, simple priority.
All right, now let's switch gears and look at Sam. Sam is brought into an urgent care clinic after a really similar event, but the second he walks through those doors, the entire context flips. The number one priority is no longer public safety, it's all about Sam's personal safety. We have officially left the world of rigid rules and entered the world of clinical judgment.
Now, for the clinician who's treating Sam, there's no simple yes or no checklist. They're facing a really high-stakes decision. Can Sam safely go home, or does he need to be sent to the ER for more intensive care? And this isn't just a quick guess. It's a really complex judgment call with big consequences. So how in the world does a clinician even make that call? Well, they follow a pretty logical process. First, they figure out just how severe the episode was. Then they play detective and try to pinpoint the cause. Did Sam miss a meal? Was it a new medication? After that, they have to assess the risk of it happening again soon. It's only after weighing all of that that they can finally decide ER or home. And you can really see that balancing act right here. A trip to the ER is probably going to happen if the episode was really bad, if they can't figure out the cause, or if Sam lives alone and has no one to watch him. But on the flip side, if the cause was simple and easy to fix, and Sam is totally alert and has good support at home, sending him home might be the perfectly right call. It is all about the specific individual context.
Okay, so we followed Alex down the path of public safety rules, and we followed Sam down the path of personal clinical judgment. Now let's bring these two stories back together and really dig into why the exact same medical condition can get two totally different answers.
This table really just lays it all out, plain and simple. For the commercial driver Alex, the priority is public safety. The result? A rule-based action. Usually he's not medically qualified. For the ordinary patient Sam, the priority is patient safety. And the action there? It's all based on case-by-case judgment. It's two different priorities running on two totally different operating systems.
And there's another really important piece of the puzzle on Sam's side of things: legal liability. See, for that urgent care clinician, there's a huge risk if they send a patient home and then something bad happens, especially if the episode was severe or the cause was a mystery. That pressure often makes them err on the side of caution and just send the patient to the ER.
Let's really sharpen this contrast by looking at a severe episode. For the DOT, a severe episode is an automatic full-stop safety threat. End of story. The discussion is pretty much over. But in urgent care, that very same event isn't the end of the conversation, it's the start of one. It kicks off a deep dive into the cause, the patient's stability, and their risk in the future.
So, after all this, after following Alex and Sam on their separate journeys, we get to the real lesson here. It's not just about the medical condition. It's about the world in which that condition is being looked at. And the crucial takeaway is that context is absolutely everything.
This one sentence just nails it, doesn't it? It perfectly captures the whole story. In Alex's world, the system's job is to protect everyone else from him. But in Sam's world, the system's job is to protect him from his condition. It's the same event, but a complete 180 on the priorities.
So what it all boils down to is this: the context decides the priority. Is it about the public or the patient? One system uses rigid black and white rules to make decisions, while the other relies on nuanced individual clinical judgment. It just goes to show how a single diagnosis can mean two completely different things, all depending on who you are and where you are. And that really leaves us with a much bigger question, one that goes way beyond this specific case. See, the story of Alex and Sam isn't just about medicine. It's a perfect example of this fundamental tension we see all over society. How do we build systems that can effectively balance the needs and the rights of one person against the safety and the well-being of everyone else? It's something to think about.